baby out, you're suctioning, you're looking for nuchal cord, you're dropping the shoulder down, you're doing everything to get the baby out, you're suctioning again, you're rubbing the baby down, you're getting it to mom quickly, and that's how you're going to end your third stage. And then you're going to deliver your placenta. And then in your fourth stage is basically just watching the mom make sure that she's hemodynamically stable, make sure she's doing okay. And those are all the major stages. It's time for the end of session quiz. I want you to pause the video, answer all the questions in the end of session quiz, and then restart the video, and then we'll go over the answers together.
All right, let's go through the answer to your end of session quiz. First, what should always be done when applying cord traction during active management of placenta delivery? Well, the other hand should secure the uterus to prevent uterine inversion. Next, a 22-year-old G1P0 patient is in the active phase of labor. She's dilated to 6 centimeters and is 50% effaced. Her external tocometer shows a consistent contraction pattern, but she's not dilated for over 2 hours. So what's the next step in her management? Well, this sounds a lot like the patient we discussed in the quick review, but don't be tempted to diagnose this patient with active phase arrest yet. We know she's having contractions, but we don't know the power of these contractions. An intrauterine pressure catheter, or IUPC, could be used to measure the pressure of the contractions, and if her Montevideo units are below 200, then that could be the problem. This patient could then be given oxytocin to help augment her labor, and then she may progress to a vaginal birth. Next, list the minimum gear and materials you need for a vaginal delivery. So you should be gowned, gloved, and goggled. You'll need 2 clamps, scissors, a suction bulb, DITLAB7 suction trap, and you'll need sterile towels. Next, describe the 4 stages of labor. So the first stage of labor is the interval between the onset of labor and full cervical dilation. There's a latent phase, which is the beginning of labor to 3 to 4 centimeters of cervical dilation, and then there's the active phase, which is 4 to 10 centimeters of cervical dilation. And then the second stage of labor is the time period between complete cervical dilation and the delivery of the infant. The third stage of labor begins after the delivery of the infant and ends with the delivery of the placenta. And then the fourth stage of labor is the 2-hour period after the delivery of the placenta. Next, match the type of perineal laceration with its corresponding degree. So first degree involves the mucosa or the skin. Second degree extends into the perineal body. Third degree extends into the anal sphincter. And fourth degree extends into the mucosa. Next, what is the difference between expectant and active management of placental delivery? So expectant management is passive, and this consists of delivery of the placenta without the use of uterotonic agents, cord clamping, or cord traction. Active management, on the other hand, consists of early cord clamping, controlled cord traction, and administration of a uterotonic agent like oxytocin, which is given before or after delivery of the placenta to reduce the risk of uterine hemorrhage. Next, what's considered an abnormally prolonged second stage of labor? In a nulliparous patient, if the second stage of labor is greater than 2 hours or greater than 3 hours if the patient has had an epidural, and for a multiparous patient, if the second stage of labor is greater than 1 hour or greater than 2 hours if the patient has had an epidural. Next, what are the next several management steps after the head of the infant is delivered? So you should evaluate for nuchal cord and reduce the nuchal cord if needed. You place a hand on each parietal eminence of the baby's head, and then you gently use downward traction to help slip the anterior shoulder under the pubic symphysis and deliver the rest of the baby. Next, after the baby is born and no signs of fetal distress are apparent, what should be encouraged? Well, you want to encourage early interaction with the mother, skin-to-skin interaction, very important. And you also want to encourage early initiation of breastfeeding. Next, what are the potential positive and negative effects of delayed cord clamping? So the positive effects, there's more blood transferred from the placenta to the infant, and this has a potential value of decreasing rates of neonatal anemia. The negative effects include potential increased risk of polycythemia and risk of neonatal jaundice. So that's the end of this end of session quiz and the end of this lecture. Hope you learned something. Good luck studying.